Cancer. It is the abnormal growth of skin cells, most often develops on skin exposed to the sun. But this common form of cancer can also occur on areas of your skin not ordinarily exposed to sunlight. There are three major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. You can reduce your risk of skin cancer by limiting or avoiding exposure to ultraviolet radiation. Checking your skin for suspicious changes can help detect skin cancer at its earliest stages. Early detection of skin cancer gives you the greatest chance for successful skin cancer treatment. Well, earlier on this channel, I have already posted a short video about skin cancer. I hope you have seen already that video, and today I am going to present this illness in detail. Well, first of all, let me tell you the symptoms of skin cancer. Where skin cancer develops. Skin cancer develops primarily on areas of sun-exposed skin, including the scalp, face, lips, ears, neck, chest, arms, and hands, and on the legs in women. But it can also form on areas that rarely see the light of day. Your palms, beneath your fingernails or toenails, and your genital area. Skin cancer affects people of all skin tones, including those with darker complexions. When melanoma occurs in people with dark skin tones, it is more likely to occur in areas not normally exposed to the sun, such as the palms of the hand and soles of the feet. Now I'll tell you the symptoms of basal cell carcinoma. Basal cell carcinoma usually occurs in sun-exposed areas of your body, such as your neck or face. Basal cell carcinoma may appear as a pearly or waxy bump, a flat flesh-colored or brown scar-like lesion, a bleeding or scabbing sore that heals and returns. Coming to the squamous cell carcinoma signs and symptoms. Well, most often, squamous cell carcinoma occurs on sun-exposed areas of your body, such as your face, ears, and hands. People with darker skin are more likely to develop squamous cell carcinoma on areas that are not often exposed to the sun. Squamous cell carcinoma may appear as a firm red nodule, a flat lesion with a scaly, crushed surface. Now I'll tell you about melanoma signs and symptoms. Melanoma can develop anywhere on your body in otherwise normal skin or in an existing mole that becomes cancerous. Melanoma most often appears on the face or the trunk of affected men. In women, this type of cancer most often develops on the lower legs. In both men and women, melanoma can occur on skin that has not been exposed to the sun. Melanoma can affect people of any skin tone. In people with darker skin tones, melanoma tends to occur on the palms or soles, or under the fingernails or toenails. Melanoma signs include a larger brownish spot with darker speckles, a mole that changes in color, size or feel or that bleeds. You can see a mole, existing mole in your body that changes in color, size or feel or that bleeds. Okay. A small lesion with an irregular border and portion that appear red, pink, white, blue or blue-black. A painful lesion that itches or burns. Dark lesions on your palms, soles, fingertips or toes or on mucous membranes lining your mouth, nose, vagina or anus. So these are the symptoms of melanoma. Now I'll tell you some signs and symptoms of the less common skin cancer. Okay. Other less common types of skin cancer include Kaposi sarcoma. This rare form of skin cancer develops in the skin's blood vessel and causes red or purple patches on the skin or mucous membranes. Kaposi sarcoma mainly occurs in people with weakened immune systems, such as people with AIDS, and in the people taking medication that suppress their natural immunity, such as people who have undergone organ transplants. Other people with an increased risk of Kaposi sarcoma include young men living in Africa or older men of Italian or Eastern European Jewish heritage. Merkel cell carcinoma. Merkel cell carcinoma causes firm, shiny nodules that occur on or just beneath the skin and in hair follicles. Merkel cell carcinoma is most often found on the head, neck, and trunk. Sebaceous gland carcinoma. This uncommon and aggressive cancer originates in the oil glands in the skin. Sebaceous gland carcinomas, which usually appear as hard, painless nodules, can develop anywhere but most often occur on the eyelid, where they are frequently mistaken for other eyelid problems. Well, regarding eye, I have already posted videos about different eye problems. You can see those informative videos. Okay. Make an appointment with your doctor if you notice any changes to your skin that worry you. Not all skin changes are caused by skin cancer. Your doctor will investigate your skin changes to determine a cause. Now I will tell you the causes of skin cancer. Well, skin cancer occurs when mutations occur in the DNA of skin cells. The mutations cause the cells to grow out of control and form a mass of cancer cells. The cells involved in the skin cancer, skin cancer begins in your skin's top layers, the epidermis. The epidermis is a thin layer that provides a protective cover of skin cells that your body continuously sheds. The epidermis contains three main types of cells. Squamous cells lie just below the outer surface and function as the skin's inner lining. Basal cells, which produce new skin cells, sit beneath the squamous cells. Melanocytes, which produce melanin, and this is the pigment that gives skin its normal color, are located in the lower part of your epidermis. Melanocytes produce more melanin when you are in the sun to help protect the deeper layers of your skin. Where your skin cancer begins determine its type and your treatment options. Ultraviolet light and other potential causes. Much of the damage to DNA in skin cells results from ultraviolet radiation found in the sunlight and in the lights used in tanning beds. But sun exposure does not explain skin cancer that develop on skin not ordinarily exposed to sunlight. This indicates that other factors may contribute to your risk of skin cancer, such as being exposed to toxic substances or having a condition that weakens your immune system. Now I will tell you the risk factor. Well, factors that may increase your risk of skin cancer include fair skin. Anyone, regardless of skin color, can get skin cancer. However, having less pigment, melanin in your skin provides less protection from damaging ultraviolet radiation. If you have blonde or red hair and light colored eyes, and you freckle or sunburn easily, you are much more likely to develop skin cancer than is a person with darker skin. Well, regarding sunburn, I have already uploaded a video about sunburn. That is very informative video. You can see that video. Okay. If you have a history of sunburn, having had one or more blistering sunburns as a child or teenager increases your risk of developing skin cancer as an adult. Sunburn in an adulthood also are a risk factor. Excessive sun exposure. Anyone who spends considerable time in the sun may develop skin cancer, especially if the skin is not protected by sunscreen or clothing. Tanning, including exposure to tanning lamps and beds, also puts you at risk. A tan is your skin's injury response to excessive ultraviolet radiation. Sunny or high altitude climates. People who live in sunny, warm climates are exposed to more sunlight than are people who live in colder climates. Living at higher elevations where the sunlight is strongest also exposes you to more radiation. Moles. People who have many moles or abnormal moles called dysplastic nevai are at increased risk of skin cancer. These abnormal moles, which look irregular and are generally larger than normal moles, are more likely than others to become cancerous. If you have a history of abnormal moles, wash them regularly for changes. And there are some precancerous skin lesions. Having skin lesions known as actinic keratosis can increase your risk of developing skin cancer. These precancerous skin growths typically appear as rough, scaly patches that range in color from brown to darker pink. They are most common on the face, head, and hands of fair-skinned people whose skin has been sun damaged. A family history of skin cancer. If one of your parents or a sibling has had skin cancer, you may have an increased risk of the disease. A personal history of skin cancer. If you develop skin cancer once, you are at risk of developing it again. A weakened immune system. People with weakened immune system have a greater risk of developing skin cancer. This includes people living with HIV/AIDS and those taking immunosuppressant drugs after an organ transplant. Exposure to radiation. People who received radiation treatment for skin conditions such as eczema and acne may have an increased risk of skin cancer, particularly basal cell carcinoma. Exposure to certain substances. Exposure to certain substances such as Arsenic may increase your risk of skin cancer. Now I will tell you some preventive measures. Well, most skin cancer are preventable. To protect yourself, you should follow the cancer preventing tips which I am going to tell you now. Avoid the sun during the middle of the day. For many people in different parts of the world, the sun rays are strongest between 10 a.m. and 4 p.m. Schedule outdoor activities for other types of the day, even in winter or when the sky is cloudy. You absorb UV radiation year round, and clouds offer little protection from damaging rays. Avoiding the sun at the strongest helps you avoid the sunburns and suntans that cause skin damage and increase your risk of developing skin cancer. Sun exposure accumulated over time also may cause skin cancer. Wear sunscreen year round. Sunscreen do not filter out all harmful UV radiation, especially the radiation that can lead to melanoma, but they play a major role in an overall sun protection program. Use a broad spectrum sunscreen with an SPF of at least 30, even on cloudy days. Apply sunscreen generously and reapply every 2 hours or more often if you are swimming or perspiring. Use a generous amount of sunscreen on all exposed skin, including your lips, the tips of your ears, and the backs of your hands and neck. Wear protective clothing. Sunscreens do not provide complete protection from ultraviolet rays, so cover your skin with dark, tightly woven clothing that covers your arms and legs, and a broad brimmed hat which provides more protection than a baseball cap or visor does. Some companies also sell photoprotective clothing. A dermatologist can recommend an appropriate brand. Do not forget sunglasses. Look for those that block both types of UV radiation, I mean UVA and UVB rays. Avoid tanning beds. Lights used in tanning beds emit UV rays and can increase your risk of skin cancer. Be aware of sun sensitizing medications. Some common prescriptions and over-the-counter drugs, including antibiotics, can make your skin more sensitive to sunlight. Ask your doctor or pharmacist about the side effects of any medication you take. If they increase your sensitivity to light, take extra precautions to stay out of the sun in order to protect your skin. Check your skin regularly and report changes to your doctor. Examine your skin often for new skin growth or changes in existing moles, freckles, bumps, and birthmarks. With the help of mirrors, check your face, neck, ears, and scalp. Examine your chest and trunk and the tops and undersides of your arms and hands. Examine both the front and back of your legs and your feet, including the soles and the spaces between your toes. Also check your genital area and between your buttocks. Now I will tell you about the diagnosis of skin cancer. Well, to diagnose skin cancer, we may examine your skin. Your doctor may look at your skin to determine whether your skin changes are likely to be skin cancer. Further testing may be needed to confirm that diagnosis. We can also remove a sample of suspicious skin for testing. That is skin biopsy. Well, we may remove the suspicious looking skin for lab testing. A biopsy can determine whether you have skin cancer, and if so, what type of skin cancer you have. Then we determine the extent of skin cancer. If your doctor determines you have skin cancer, you may have additional tests to determine the staging of the skin cancer. Because superficial skin cancer such as basal cell carcinoma rarely spread, a biopsy that removes the entire growth often is the only test needed to determine the cancer stage. But if you have a large squamous cell carcinoma, Merkel cell carcinoma, or melanoma, your doctor may recommend further tests to determine the extent of the cancer. Additional tests might include imaging tests to examine the nearby lymph nodes for signs of cancer, or a procedure to remove a nearby lymph node and test it for signs of skin cancer. This is known as a sentinel lymph node biopsy. Doctor use the Roman numerals 1 through 4 to indicate a cancer stage. Stage 1 cancers are small and limited to the area where they begin. Stage 4 indicates advanced cancer that has spread to other areas of the body. The skin cancer stage helps determine which treatment option will be the most effective. Now coming to the treatment. Well, your treatment options for skin cancer and the precancerous skin lesions known as actinic keratosis will vary depending on the size, type, depth, and location of the lesions. Small skin cancer limited to the surface of skin may not require treatment beyond an initial skin biopsy that removes the entire growth. If additional treatment is needed, options may include freezing. Your doctor may destroy actinic keratosis and some small early skin cancer by freezing them with liquid nitrogen, that is known as cryosurgery. The dead tissue sloughs up when it thaws. Excisional surgery. This type of treatment may be appropriate for any type of skin cancer. Your doctor cuts out, excises the cancerous tissue and a surrounding margin of healthy skin. A wide excision removing extra normal skin around the tumor may be recommended in some cases. And the third option of treatment is Mohs surgery. This procedure is for larger, recurrent, or difficult to treat skin cancer, which may include both basal and squamous cell carcinoma. It is often used in areas where it is necessary to conserve as much as skin as possible, such as on the nose. During Mohs surgery, your doctor removes the skin growth layer by layer, examining each layer under the microscope until no abnormal cells remain. This procedure allows cancerous cells to be removed without taking an excessive amount of surrounding healthy skin. Curettage and electrodesiccation or cryotherapy. After removing most of a growth, your doctor scrapes away layers of skin cells using a device with a circular blade, curette. An electric needle destroys any remaining cancer cells. In a variation of this procedure, liquid nitrogen can be used to freeze the base and edges of the treated area. These simple, quick procedures may be used to treat basal cell cancer or thin squamous cell cancers. Radiation therapy. Radiation therapy uses high-powered energy beams such as X-rays to kill cancer cells. Radiation therapy may be an option when cancer cannot be completely removed during surgery. Chemotherapy. In chemotherapy, drugs are used to kill cancer cells. For cancer limited to the top layer of skin, creams or lotions containing anti-cancer agents may be applied directly to the skin. Systemic chemotherapy can be used to treat cancer that have spread to other parts of the body. Photodynamic therapy. This treatment destroys skin cancer cells with the combination of laser light and drugs that makes cancer cells sensitive to light. Biological therapy. Biological therapy uses your body's immune system to kill cancer cells. Well, this was my video about skin cancer. I hope you like this video. If you have a question about skin cancer, you can post your question in the comment section of this video.